Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hello and welcome to this week's episode of the podcast. You may have heard of Barbie Botox. Well, that is the topic of today's episode. It seems that since the Barbie movie has been released, there is a ton of information and there's a big trend going on right now to have what is known as Barbie Botox. So today I thought we would jump into that. I could tell you a little bit about what that is, how it works, and hopefully it gives you a little bit more information to make a better informed decision about whether or not you want to go ahead and get this procedure known as Barbie Botox. So let's get into this. What is Barbie Botox? Well, it is a trend where people are having Botox or neuromodulator injected into their trapezius muscles. So let's talk about the trapezius muscle. What is that? It is a broad, kite-shaped muscle that goes across the entire upper back and extends down a little bit to the mid-back. This muscle is very important for lifting things. So if you place your hands by your side and you shrug your shoulders, lift your shoulders up, you are using your trapezius muscle. And in fact, a lot of people go to the gym and work out this muscle specifically to get good definition in this muscle. This muscle does function to help you lift your shoulders, and it helps you then to, in turn, lift things that you may be holding when you have to move your shoulders up. So why would somebody want to inject this muscle with neuromodulator? Well, as you may know, neuromodulator works by relaxing the muscle, and it limits the function of that muscle to a certain degree. That's why people get neuromodulators such as Botox, Dysport, Xeomin, Nuceiva in their face, because they want to relax the muscles. The muscle is less active, and then you get less wrinkles in those areas. Well, in the trap, when you do that, the muscle is going to have less strength. And this has actually been used for quite some time for therapeutic purposes. The obvious one that comes to mind is the use of this neuromodulator in the trap for migraines. A lot of time, migraines can be coming from neck tension. And when you inject the neuromodulator into the trap, into the trapezius muscle, this helps to relax the muscle, and in turn, you have less migraines. That's the theory. And in fact, there are very clear protocols for migraines that call for injecting the neuromodulator into the trapezius. This is standard. This is readily accepted, and it is readily available. The key to distinguish this type of treatment, though, from the Barbie Botox treatment, where you're injecting the neuromodulator into the trapezius as well, is the outcome. With regards to the therapeutic treatment for the migraine, we are trying to decrease pain. Another example of that is those people that may have some muscle knots or muscle spasms. Again, you can inject a neuromodulator, and that can help to decrease the pain. In the case of Barbie Botox, these people that are getting this treatment are looking for a way to atrophy the trapezius. So they are essentially trying to get the muscle to appear smaller. Now, when you look at the typical Barbie toy, the Barbie doll toy, the angle from the neck to the top of the shoulders is essentially a right angle. And that's because Barbie really does not have a trapezius muscle. And this is the type of look that has become quite in fashion today. The idea of having a very long, slender neck coming down and then forming a right angle to extend out towards the shoulders. And that is essentially the Barbie look. And this is what people are interested in doing. Atrophying muscles is not something that is new when it comes to neuromodulators. We do it for masseters, the muscles on the sides of the face, to help to slim the face. Interestingly, we also treat the masseters to help when those muscles are very tight and people get pain from clenching their jaw. But when you increase the dose, you can actually cause the masseter to atrophy a little bit, and that can cause some facial slimming. Another common place where people choose to have their muscles atrophy due to neuromodulator is in the calves. There are a variety of cultures where it is seen as beautiful and attractive to have very slender calves, and these people prefer not to have bulky muscular calves, and this is one way to achieve that, by injecting the neuromodulator into the calves. And so this is the idea, again, with the Barbie Botox, or trapezius as it's sometimes referred to as. It is for people that want to inject the muscle, a higher dose of Botox or neuromodulator into the trap muscle to allow it to atrophy and create a 90-degree angle essentially between the plane of the top of the shoulders and the neck. Now, whether or not you think this is attractive is obviously your call. You can search for this online, and I'm sure you'll see lots of pictures of it. If you just search for the Barbie doll, you will see what I am describing, the 90-degree angle. One thing that I want to caution people about, though, if they get this, is that this muscle does have a function. And again, I mentioned at the beginning, the function of this muscle is to help to elevate the shoulders. It helps you to lift things up. And you need to keep in mind that if you treat this muscle to the point that it's not only weak, but it's also starting to atrophy, you will have significant weakness in your trap. And that may or may not, but it may cause some functional problems when it comes to lifting things up. So this is something that you have to take into account. As always, it's a balance between the aesthetic and what you're going for and what you perceive to be attractive versus the potential side effects of having the treatment to achieve that objective. And again, in this case, it is a weak trap, which could have some effect on your ability to lift things. So there's no judgment here. This treatment is very trendy right now. There are lots of women who want to have this treatment done to slim their neck, to atrophy their traps, and to have that Barbie look. But again, you just need to keep in mind that the potential side effects are something that do definitely need to be considered. So, what's the bottom line here? The bottom line is that if you are thinking to have this type of treatment, then you need to consult with somebody who has some expertise in neuromodulators and can understand the subtleties in terms of what we're trying to achieve with the aesthetic, but also the functional limitations that could be there as a result of that treatment. As always, if you want to discuss this with me, feel free to reach out. I'm at antiagingvancouver.com or at drterifisher.com. I hope that's helpful for you. I hope it answers a few of the questions that you may be having around the idea of Barbie Botox or trapezius. And I always think that the more knowledge you have, the better informed decisions you can make. With that being said, I hope you have a wonderful week. And as always, I'll talk to you again next time.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.